Hello guys, welcome to my channel Art by Fazzy TV. Please subscribe it and press the bell icons for the latest videos. Today topic is rheumatic fever. Introduction. Rheumatic fever is an inflammatory disease that can develop when strep throat or scarlet fever isn't properly treated. Strep throat and scarlet fever are caused by an infection with Streptococcus streptococcus bacteria. Rheumatic fever most often affects children who are between 5 and 15 years old, though it can develop in younger children and adults. Although strep throat is common, rheumatic fever is rare in the United States and other developed countries. However, rheumatic fever remains common in many developing nations. Rheumatic fever can cause permanent damage to the heart, including damaged heart valves and heart failure. Treatments can reduce damage from inflammation, lessen pain and other symptoms, and prevent the recurrence of rheumatic fever. Symptoms. Rheumatic fever signs and symptoms, which result from inflammation in the heart, joints, skin or central nervous system, can include fever, painful and tender joints, most often in the knees, ankles, elbows and wrists, pain in one joint that migrates to another joint, red, hot or swollen joints, small, painless bumps beneath the skin, chest pain, heart murmur, fatigue, flat or slightly raised, painless rash with a ragged edge, jerky, uncontrollable body movements Sydenham chorea, most often in the hands, feet and face, outbursts of unusual behavior, such as crying or inappropriate laughing, that accompanies Sydenham chorea. Causes. Rheumatic fever can occur after a throat infection from a bacteria called Group A streptococcus. Group A streptococcus infections of the throat cause strep throat or, less commonly, scarlet fever. Group A streptococcus infections of the skin or other parts of the body rarely trigger rheumatic fever. The link between strep infection and rheumatic fever isn't clear, but it appears that the bacteria trick the immune system. The strep bacteria contain a protein similar to one found in certain tissues of the body. The body's immune system, which normally targets infection-causing bacteria, attacks its own tissue, particularly tissues of the heart, joints, skin and central nervous system. This immune system reaction results in swelling of the tissues, inflammation. If your child receives prompt treatment with an antibiotic to eliminate strep bacteria and takes all medication as prescribed, there's little chance of developing rheumatic fever. If your child has one or more episodes of strep throat or scarlet fever that aren't treated or aren't treated completely, he or she might develop rheumatic fever. Risk factors. Factors that can increase the risk of rheumatic fever include family history. Some people carry a gene or genes that might make them more likely to develop rheumatic fever. Type of strep bacteria. Certain strains of strep bacteria are more likely to contribute to rheumatic fever than are other strains. Environmental factors. A greater risk of rheumatic fever is associated with overcrowding, poor sanitation and other conditions that can easily result in the rapid transmission or multiple exposures to strep bacteria. Complications. Inflammation caused by rheumatic fever can last a few weeks to several months. In some cases, the inflammation causes long-term complications. Rheumatic fever can cause permanent damage to the heart, rheumatic heart disease. It usually occurs 10 to 20 years after the original illness, but severe cases of rheumatic fever can cause damage to the heart valves while your child still has symptoms. Problems are most common with the valve between the two left chambers of the heart, mitral valve, but the other valves can be affected. The damage can result in narrowing of the valve. This decreases blood flow. A leak in the valve. A leaky valve causes blood to flow in the wrong direction. Damage to the heart muscle. The inflammation associated with rheumatic fever can weaken the heart muscle, affecting its ability to pump. Damage to the mitral valve, other heart valves or other heart tissues can cause problems with the heart later in life. Resulting conditions can include an irregular and chaotic heartbeat, atrial fibrillation, heart failure. Diagnosis. Although there's no single test for rheumatic fever, diagnosis is based on medical history, a physical exam and certain test results. Blood tests. If your child was already diagnosed with a strep infection using a throat swab test, your doctor might not order additional tests for the bacteria. Sometimes, a blood test that can detect antibodies to the strep bacteria in the blood is done. The actual bacteria might no longer be detectable in your child's throat tissues or blood. To test for rheumatic fever, your doctor is also likely to check for inflammation by measuring inflammatory markers in your child's blood, which include C-reactive protein and the erythrocyte sedimentation rate. Electrocardiogram (ECG or EKG). This test records electrical signals as they travel through your child's heart. The results can tell if the electrical activity of the heart is abnormal and can help your doctor determine if parts of the heart may be enlarged. Echocardiogram. Sound waves are used to create live-action images of the heart, which can help your doctor to detect heart problems. Echocardiogram. Electrocardiogram (ECG or EKG). Treatment. The goals of treatment for rheumatic fever are to destroy remaining group of streptococcal bacteria, relieve symptoms, control inflammation and prevent the condition from returning. Treatments include antibiotics. Your child's doctor will prescribe penicillin or another antibiotic to eliminate remaining strep bacteria. After your child has completed the full antibiotic treatment, the doctor will begin another course of antibiotics to prevent recurrence of rheumatic fever. Preventive treatment will likely continue through age 21 or until your child completes a minimum 5-year course of treatment, whichever is longer. People who have had heart inflammation during rheumatic fever might be advised to continue preventive antibiotic treatment for 10 years or longer. Anti-inflammatory treatment. Your doctor will prescribe a pain reliever, such as aspirin or naproxen, naproxen, naprelin, Anaprox DS, to reduce inflammation, fever and pain. If symptoms are severe or your child isn't responding to the anti-inflammatory drugs, your doctor might prescribe a corticosteroid. Anticonvulsant medications. For severe involuntary movements caused by Sydenham chorea, your doctor might prescribe anti-seizure medications, such as valproic acid, dopakine, or carbamazepine, carbatrol, tegretol, others. For more informative videos, please subscribe my channel Art by Fazzy TV.